Hi. Thanks for taking the time to visit us at the Center for School Behavioral Health at Mental Health America of Greater Houston. The center's mission is to improve the prevention, early identification, intervention, and treatment of behavioral health issues among students. We do this by providing training modules, lesson plans, and activities that are designed to build a school's internal capacity to infuse mental health into the campus culture. The center currently works with 30 school districts and 80 organizations in the greater Houston community. So for our training purposes today, we want the audience to be able to understand their role as a caregiver, recognize signs and symptoms of stress, help them define self-care, identify strategies for self-care in the moment, and have the ability to create a self-care plan. The center has 2 professional development specialists who are responsible for designing and facilitating the training with trainings to student-facing professionals. My name is Nicole Milton, and I'm excited to facilitate this training opportunity for you because I believe in the work that we do at the center, and it is my hope that more school districts will prioritize mental and behavioral health of their students. As you can see, I'm down here on the right. I'm a former science teacher. I also love to build relationships. I'm a people person, and I'm a conservative thrill seeker, which means I love a good thrill, but I want to do it as safely as possible. Here's where we're heading during this video. We're going to define caregiver, especially during COVID, identify common and COVID-related stressors, be able to recognize the signs and symptoms of stress in ourselves and others, and create a self-care plan. Typically, the term caregiver refers to paid professionals or family members who regularly look after the well-being of sick, elderly, or disabled people. For the purposes of this training, we're going to use the term caregiver to refer to someone who is providing care for another person. And based on the current state of affairs in our world today, caregivers are now our parents and guardians. So we want to make sure we lump them in with being caregivers. Due to the COVID-19 pandemic, we are being required to practice social distancing and advised to quarantine ourselves in our home. Given these stipulations, school and work are happening remotely, which means we are around family throughout the day. This new routine can cause frustration for everyone as we all adjust. So parents and guardians are being called upon to respond to the demands of work while simultaneously being on call for kids, which can compound any already existing stress. So what are some things that we're already experiencing as stressors? For example, life changes, competing demands, emotional strain, financial strain, or any uncertainty. We all know that everyone reacts differently to stressful situations, such as an infectious disease outbreak that requires social distancing, quarantine, or isolation. So we understand that our lives are moving and we're having to adjust in different ways. So we're all going to react differently to those stressors. Stress from caregiving in the moment, so thinking about COVID-related stressors, we often find that caregivers put the needs of others above their own. So feeling like on call constantly can feel overwhelming. So you're needing to pay attention to work or find work, and then your significant others or your family members are needing you. So you're feeling like you're on call constantly. And then there's also the additional stress of this infectious disease. So we're worrying about our health. There's confusion in the media. There's anxiety and anger and frustration. So there's a lot happening in our homes and even to the people around us. So it may not necessarily be happening to us, but even taking on that additional stress of seeing other people in distress can also cause us to feel some type of stress. Stress or caregiver stress can take many forms. So we can see stress um, thinking about what's happening with our mental capacity, our emotions, physically, what we could be feeling, or how our behaviors may change. For example, you may feel frustrated and angry one minute and helpless the next. So when we think about signs and symptoms, we know that signs can be observed externally while symptoms are felt internally. So you may be feeling overwhelmed, feeling alone, isolated, sleeping too much, too little, losing interest, being easily irritated or angered, feeling worried or sad. So these are all signs and symptoms of stress, and we wanted to make sure that you understand what could be happening with you or with others in your family. One of the many ways you can manage your stress is by engaging in self-care. Self-care is looking after your mental health and well-being so that you can effectively support those around you. If you're not at your best, you can't give your best. Actively looking after your own mental health and well-being is essential so that you can effectively support yourself and those around you. It's doing what you need to do to be the best version of yourself. So if that means doing tasks that you have been putting off, setting boundaries or saying no, there's nothing wrong with saying no or asking for help, knowing when to ask for help. It's also important to note that self-care is neither selfish or a luxury. It's the skills a person uses to stay physically and emotionally healthy in times of stress. We also talk about self-care in terms of like walks, baths, and aromatherapy, and that sometimes that's not all that self-care can be. It's just a matter of doing the things that you don't want to do today so that your well-being is better tomorrow. So self-care is absolutely necessary. So if you find yourself in a stressful moment or an overwhelming situation, this self-soothing exercise is called grounding. It can be super helpful. So you can pause the video right now and just for a minute, go through the steps on the slide silently to yourself, or if you're with family, go ahead and do the activity. You can either write them down or say them to yourself. All right. Notice how you feel after you've gone through that exercise, even though we're just practicing in the moment. Think about where in what situations would this technique be super helpful to you. I would take the time to write down these steps so that you can practice them in the moment wherever you may need them. All right, so this is emergency self-care for when you need an instant boost. You can feel free to write down the answers to these prompts. So maybe pause the video here and take about 2 minutes. And then transfer those somewhere where you would keep them, where you can actively look at them. If you want to put them on the refrigerator or put them next to your bed, take a moment and go through prompts and find an answer for them. Hopefully you were able to complete this task and it actually brought on some soothing relief for you to know that there are some things that you can do in the moment to take care of yourself. Some other ideas for self-care: create or spruce up a sacred space. Um, if you always wanted to decorate something or put a picture up, get somewhere where you can just have a moment of peace to yourself. Exercise is always great for maintaining your mental health. It doesn't have to be hard exercise. You could take a walk, you could do jump rope, play games outside, YouTube videos. I love learning choreography. Practicing gratitude is also another type of grounding activity that allows you to stop focusing on what's irritating you or stressing you in the moment and give you an opportunity to refocus your thoughts on something else. You can also write a letter to yourself or your higher source or to a friend or whoever else you would like to. Writing oftentimes helps us to refocus our energy from the thing that is bothering us, and also can help us identify specific feelings that we may be having and just kind of remove us from that moment of irritation to a more calm sense of self. So now you're going to select one goal that you want to work towards that will improve your self-care. We talked about emergency in the moment. So now we want to look at long-term. So we're going to use the SMART goals process to create a goal for yourself, for your family, for friends. If you're already doing something for your self-care and you know someone who could use an opportunity to kind of focus not so much on the things like COVID that's stressing them out, or being inside or quarantined or isolated, you can also share this with them. So SMART stands for specific, measurable, attainable, relevant, and timely. So I'll just go over a quick example of one of my SMART goals for self-care. I want to achieve taking 15 minutes out of my day to go outside and walk around, just to keep myself active and to give myself a moment away from all of my technology and social media, etc. Just take 15 minutes to just center myself and relax and breathe. So that's what I want to achieve. The physical outcome of the goal. So I want to measure just the time, my 15 minutes each day. It is a realistic goal because I do have 15 minutes. I want to reach this goal because I want to keep myself active and I want to, take care of my mental health. And timely, I want to do this for at least 2 weeks. I think if I can do it for 2 weeks, and I can start to build it as another goal. And also remember that SMART goals utilize positive language. So we don't want to be negative with ourselves at this time. Self-care is about being gentle with yourself and just setting a goal that is attainable and reachable. So that way we can see the goal, accomplish the goal, and we feel good about ourselves. And that helps us to set other goals for ourselves. So hopefully this was very helpful. You can also pause the video at this time to get down the steps or take a screenshot of the steps for the SMART goals that you can create at any time for yourself, with friends, family, etc. So that is the end of our video. Thank you so much for spending time with us. We're asking that you complete the course survey. Give us some good feedback on your experience with this video today. For more information from Mental Health America of Greater Houston, please feel free to visit our website at mhahouston.org. Any inquiries about the Center for School Behavioral Health and any of the trainings that we deliver, please feel free to email us at csbhinfo1@gmail.com. The professional development specialist who designed the training that you just saw, Sharifa Charles, and myself, Nicole Milton, our contact information is there. Thank you so much and have a great rest of your day.